I think our role is to make sure, the main role that I feel in most pharmacists that I know appears is to make sure that a medication is being used for the intended right reason. If we should see a prescription that you think that the dose is too high, or you're questioning whether this medicine should be used for this particular diagnosis, it is your job to question the doctor. And a lot of people don't want to do that because they're like, hey, the doctor knows what they're doing. They wrote it. We need to fill it. But I think that's where we've got to step in and say, hey, there may be some alternative routes that we could use, or some less addictive medications to try at first. To try to do that, and it can be an educational thing for, maybe it's a newer doctor that's not as familiar, or just giving some advice to a patient, saying, hey, these medicines are highly addictive. They're very potent. Are you sure, that that's the right thing for you? I think that's where, over the years, now you're starting to see more pharmacists take that initiative to kind of question prescriptions and make sure that they're being used and 100% authentic for the right reason. The biggest thing we've seen over the years, I've been back in this area for the past 12 years working in Danville, is the difficulty on the people that actually need the medication on getting it now. The insurance companies have got to where they don't want to pay for them because they feel like if they pay for them, they're being complicit in some of the abuse problem. So the problem you really run into is the patients that actually really need their medication. It's more difficult for them to get it, or they have to pay out of pocket and end up having to cost them a whole lot more. On the abuse side, I've seen a steady decline, I think, over the last few years, which partly is due to the doctors finally, I think, waking up and acknowledge that they maybe have been over-prescribing to people. PMP has been a big thing too. You can actually check other states as well as the state of Virginia to catch patterns of filling at multiple pharmacies and crack down on that. And then also, most pharmacies nowadays for your opiate type medications will make people go exactly 30 days between 30-day prescriptions. You don't see a lot of people that are allowed to get it a day or two early anymore. And PMP is a prescription monitoring program. The state of Virginia has that all pharmacies have to report any scheduled medication, which means any type of narcotic medication they fill during the day. They have to report it to the PMP every evening. And it's updated, I think, within 48 hours, so that if a patient tries to have a medication filled at one store and then 3 days later they try to have a same medication filled at another store, you can check that and see that it was filled and that it wouldn't be needed, and kind of take the routes that you need to take to try to curb the abuse. It's pretty standard practice now, and it's kind of just whether the technician or pharmacist handles it. It's usually done by one or the other in the pharmacy. At first it was kind of one of those things that it just added an extra step in the way, and prolonged the prescription filling process, because it does take a few minutes to go to the database, log in, check, put in the patient's information, and review their history, and make sure that they have a morphine equivalent dose that's not over the threshold. So it has kind of, but like I said, over the years now, you just kind of get used to it, to where it's just something else that's part of your routine. More prescribers are using electronic prescribing now, so they send prescriptions electronically straight from their database to the pharmacy database, and it's through a very encrypted and controlled process. So you don't have a lot of handwritten prescriptions anymore for narcotics like you used to. It used to be pretty common to see someone try to print one out and sign a doctor's name, or either they would alter the number of tablets that it was written for, but you really don't see much of that anymore due to the electronic prescribing. Narcan is a medication that will knock an opiate off of its receptor in the body, thus taking a person that's overdosed and trying to bring them back. So the Narcan, a lot of doctors will at least once a year make a patient fill a Narcan prescription if they're on a chronic pain medicines. Some doctors will even give a prescription for Narcan for people that are just getting a few day supply after a minor procedure, just so that they're following, I guess, their guidelines. The problem we run into is Narcan's pretty expensive, so a lot of people can't afford it if their insurance doesn't cover it. The thing with the Narcan is a lot of people that are abusing the medicine kind of have the approach that they don't think it's going to happen to them, that they'll be the one to overdose, and then when you do overdose, unless you have somebody with you that knows the signs and symptoms, Narcan's of no use, because if you're by yourself, there's nothing you can do, or if they don't know the signs and symptoms, they're not aware to give it to you. So that a lot of the education has to be with family members to kind of tell them about Narcan and the signs and symptoms to look for if a patient should overdose. Well, a lot of times if they're a new patient, they'll call and ask sometimes what color medicine the particular tablet is on the phone, or they'll come in and say, I don't have insurance, I just need a cash price. Usually if that's the first thing out of their mouth, it sounds like they've been there and done this before. But like I said, with everybody nowadays doing the PMP on most of your oxycodone, methadone type prescriptions, a lot of that is really caught by the PMP process, which has been a great tool since Virginia implemented it. Over the years, the out-of-state prescriptions have really declined. I would probably say 5, 6, 7 years ago, we see quite a bit try to get them filled from Kentucky, Georgia, Florida, and we always just use, hey, if you're not Virginia or North Carolina prescription, sorry. We do a lot of North Carolina scripts, being where we're located with Duke and UNC and Moses Cone and those hospitals nearby. The early prescriptions you don't see as much, because over the years people have learned that it's just more tightly regulated, and that a 30-day supply needs to last 30 days. As far as multiple doctors, most doctors now will not tolerate it. If you're at a pain management facility and you're caught going to another doctor, that's usually the first time you're kicked out of their practice. So the doctors have really done a good job of tightening down on their end too, and with the pharmacies really monitoring the day supply, it's really helped to curb the abuse problem. Not to say that it doesn't still exist. At Commonwealth, we even take back medications. We inform people the police station has a take-back box that's similar to a post office box that you can dispose of any medication at any time, no questions asked. We'll take back, but we usually, tell people to be sure that certain meds are not ones that you just want to leave laying around if you're not using them anymore, because if they get in the wrong hands, whether it's a grandchild or a son or daughter, all it takes is 1 or 2 tablets, and that can be life-threatening. Pretty regularly, people will come in and ask about where we'll get phone calls of, can we bring our medicines, or if someone's no longer using them, can we bring them back to you, or is there a location? And so we usually inform them about the police station and how they do have a drop box at all times. And then I think several times a year, the Sheriff's Department runs programs at different locations throughout the city where they really will advertise, and we'll put flyers up to let people know that those programs do exist. That is a conversation you do have a little bit, but it's probably not one that's as often. And generally, being that most people think that, and we'll tell people, say, this is a very potent medicine. It can be highly addictive. You just want to use it, especially a person that's just had like a little surgical procedure and they're getting a 4 or 5 day supply, that, hey, you don't want to use this unless you really need it, because there is the possibility of addiction. That is part of the counseling process on those. I think you see it a lot, though, where people that are in chronic pain, it becomes an issue of whether the chronic pain's there, or that's just become an addiction over the years. And I think we've seen a lot of rise in the Suboxone prescribing, and then that's a thing where sometimes you wonder if it's being used the way it was intended to be, to help wean people off, or if it's just trading one addiction for another, because it seems like a lot of those patients end up staying on that medication for a long time. I've been very fortunate that I've never had a coworker still. I've been at several pharmacies where I've been asked to go cover while loss prevention, when I worked for bigger corporations, where we did have a pharmacist in one store that was abusing himself. And it does happen. It happens more frequently than you would think. And both states have good programs that will help with that. They'll put you in there. Obviously, your license will be suspended, but both states, Virginia and North Carolina, have programs to assist pharmacists and pharmacy technicians. Most pharmacies do a pretty good background check if you're going to work in the pharmacy. You do have to pass a background check. You do get drug tested. And then random drug testing is pretty commonplace. I know when I was with Walgreens for a long time, I was with them for 10 years, and probably 6 or 7 times randomly, they would pop in and they would drug test every single person in the store. Something we take very seriously, because it's like I had a conversation. I had a friend I went to pharmacy school with that worked in Florida, and he was in part of an area where there were a lot of these so-called pill mills, and the pharmacies were filling just unrealistic amounts of medicines. And I remember we had the talk one time, and I was like, what if that was your kid that got a pill at a party and they didn't wake up? And I think if you take that approach in the back of your mind and you do as much your job to the best of your ability, hopefully you'll prevent that from happening to someone's child one day.